10 staffers with Northeast Medical Services in San Jose are holding their first COVID vaccine clinic, many of them working overtime. They say as a smaller provider targeting the underserved Asian community, they're having a tougher time reaching patients compared to larger entities like Kaiser and Stanford.
It's been pretty crazy. There are a lot of vaccine hesitancy in our population as well, so we have to explain to them.
Chief Medical Officer Kenneth Tai invited our investigative unit to see their operation after we showed them this new data. Santa Clara is one of the first counties to release how many doses are going to each provider and how many they use. As of Thursday, out of all 280,000 doses providers received, more than 96,000 remained unused. Northeast Medical had the lowest injection rate, with only 12% of their doses administered and nearly 2,000 waiting. Two other providers, also serving vulnerable ethnic communities, appear to be struggling too. Asian Americans for Community Involvement administered 21% of its vaccine supply and had more than 1,000 doses remain. And Bay Area Community Health administered 22% of its stock, with about 2,000 doses unused.
We literally got the vaccines last week, right?
And with no heads up, Dr. Tai says.
Just internally, we have to train our staff how to do the questionnaire, how to do injections.
Bay Area Community Health sent us this email saying its unused doses are a result of extreme weather destroying their vaccination structures, outreach challenges, and most community clinics not having scalable technology for appointments.
Those that are in disadvantaged communities are most at risk of not receiving a vaccine in a timely manner.
Graham Canals, Executive Director of California State Association of Counties, says these problems are statewide.
We are doubling down on our efforts to try to reach those communities in a system that is incredibly complex and changing by the day.
We are trying our hardest, trying to get the vaccines to people's arms, and we want to do the job.
Some smaller organizations tell me they have administered more of the vaccine than the data shows, but they're having a harder time reporting it. We've reached out to other counties hoping to compare this data, but they haven't yet released information based on providers. Candice Nguyen, NBC Bay Area News.